Welcome to the JEMS Report, brought to you by Clarion Events, Fire and Rescue Group, and the Journal of Emergency Medical Services. My name is Ted Lee, and I'm the editor-in-chief of JEMS Magazine. Along with Jeff Frankel, our managing editor, we will be bringing you industry experts and leaders in all things pre-hospital medicine. And today, we're talking with two very special guests to kick off EMS Week. Dr. McCabe-Kline from the American College of Emergency Physicians, and Chief Wei, the president of the National Association of EMTs. So thank you guys for joining me. I really appreciate it.
Thank you for having me.
So, thank you for having us.
Dr. McCabe-Kline, why is ACEP associated with EMS? I mean, I know it's emergency physicians, but some people don't really connect the two dots all that well to say, well, why would they have a vested stake in this?
Understood. So I will tell you that the ACEP board went through a very detailed process of EMS reimagined. And we went through an entire, series of meetings, presentations, trying to ensure that we're providing value to emergency medicine physicians. And the overwhelming answer is yes, 100% we are. So emergency medicine is not a location. It is a skill set. And that's where EMS physicians come into play. So about 7,000 of our members are EMS physician-related specialties. They might not be an EMS medical director, but they might be in that space, whatever that seems to be for them. So we have a huge population within ACEP that is extremely invested in EMS, and every emergency medicine physician interacts with EMS every day. Right? So I'm a subspecialty boarded EMS physician, so that's my wheelhouse. But all of our emergency medicine physicians that are part of ACEP have a vested interest in all of our EMS work.
Right. So Chief Wei, obviously, National Association of Emergency Medical Technicians, that makes perfect sense. But how long have they been kind of, on board with EMS Week and pushing out the EMS Week agenda?
Well, honestly, as early as when it very first started. So this is our 50th year anniversary of the NAEMT this year. And I think we've enjoyed the relationship with ACEP since the beginning of EMS Week. I really think, as the good doctor said, we're in each other's spaces intentionally. And I think that I'm fortunate to be able to call those emergency physicians colleagues, not, very much in the space that we start the patient care often under their guidance, and we deliver a patient to them or whatever taking care of that patient looks like. We are partners in the healthcare delivery. And so I really appreciate the opportunity to get to partner with them from the NAEMT standpoint, because not only does it show the collaboration that we have, but I think it shows our members and their members that we really do intersect our lives and our professional lives, especially with each other every time we take care of a patient. And so it's just, to me, it's a natural fit for NAEMT. When ACEP invited us to partner years and years and years ago, it was a natural fit for NAEMT to do so. Because again, they are our patients. And when I say our, I mean the collective group in how we give that continuum of care.
So understood. And Chief Wei, I just want to dovetail on that for 1 second and say that our patients don't understand certain delineations. They understand that they're being cared for, and they perceive us all as one team, which makes it incredibly important to collaborate at a very high level and at a very granular level to make sure that we're delivering on that obligation to our patients.
To that point, I often say, when I'm, speaking to a group of people, whether it's physicians or EMS providers or collectively as a group, maybe in a community or something, I suggest to each other that we ought to be each other's biggest champions. I ought to be seeing when I'm delivering a patient to the emergency room, I ought to say, heck yeah, these people, that's where I would take my kid if my kid was sick or injured. And I want the physician at the other end, the receiving physician, to be able to say, holy cow, we have the best EMS providers anywhere around, and truly, again, be each other's champions. So I think this is just a natural fit for us in a relationship.
Yeah. Now, with the outward-facing aspect of EMS Week, I mean, of course, you see a million remembrance days or recognition weeks, and sometimes it gets kind of lost in the void. Some providers look at this and you're like, yeah, they're going to give us cake or pizza or something, during the week. We'll get something, but this really does have a deeper meaning. So, what are we hoping to accomplish by having this recognition week, and how do we impact the outward face? I mean, when you talk to an individual provider and you talk about wellness or education or safety, they get it, they work it. They're 24/7. They know that's why they're in the business. But how do we project this a little bit more?
I think from the EMS side of things, I think knowing that we have that support from our physician colleagues is hugely important. I think not seeing, or I think our crews seeing that support from ACEP and seeing the local physicians champion EMS during that week, and no different than when it's emergency nurses week or physician week or physician day. I mean, we ought to be doing the same to them. But I think for the EMS crews out there, and you're absolutely right, I've never met a paramedic or an EMT that didn't appreciate getting a slice of pizza or a bag of chips when they're hungry and they're busy. But really, to me, EMS week is just the culmination of what it should be all the time, and that's the mutual appreciation for each other, so that we develop that cohesive relationship.
Yep. I think we started out with EMS week as an awareness opportunity, an appreciation opportunity, and now we're looking at it more as an advocacy opportunity. So really embracing EMS week and saying, hey, not only are we giving you a smoothie, but here are the things that we would like to accomplish, as an EMS community and as emergency medicine physicians. And we want to make sure that we're driving those points forward. So I think EMS week in my mind is changing a little bit. It's less of the pats on the back, which we all definitely need. And frankly, we should do it more often. However, it's now turning into an educational opportunity to say, here are our issues. Here are the things that we need to bring forward. Here's where we need our, legislature to be involved or county commissioners to be involved. This is where budgets get made. This is what our community deserves. So I think EMS week is changing a little bit in my mind. I mean, it's certainly a time for appreciation, but it's also a time for advocacy.
Yeah. And I'm sorry, go ahead.
I was just going to say, and advocacy is a word that's relatively new to the EMS world. So, I mean, even 10 years ago, we weren't doing the level of advocacy that we are now. And it should be at the local level. I mean, again, as services are facing budget challenges and cuts, and oftentimes there are places in the United States where EMS is the only healthcare provider in a community. We need to be championing those efforts year round, not just during 1 week. And so as we bring advocacy into it, I totally agree. Everybody appreciates the pat on the back, and there are never enough of those. But we also have to be talking about how important each other is. I mean, how important a hospital is. And if it didn't have emergency physicians in it, what kind of void that would leave us or our patients. We need to look at what kind of void it would leave a community if they didn't have a good EMS in their community providing healthcare to those patients. Like it or not, we often end up being a lot of people's primary healthcare provider in both EMS and the emergency room. And so that is definitely something that we need to pay attention to all the time.
Yeah. Well, when you look at the individual days, of course, 7 days for the week, health and wellness, education, safety, children, EMS children's, Save a Life Day, Recognition Day, and Remembrance Day. 3 out of the 7 are kind of internally facing, but then I view it as education, safety, children, and Save a Life as very much outward facing, engagement in the community and kind of showing, to your point, the advocacy of this is what EMS does for its community and how it can, kind of stimulate those kind of conversations to where it's not just a single pat on the back or Remembrance Day.
But I think to Chief Way's point, emergency medicine is a skill set, not a location. And as we see, as emergency medicine expands, our EMS work is expanding as well. So we're going into tent city with our community paramedics who have no other access to care. We're going anywhere and everywhere that a patient might need us. There are a large number of assisted living facilities that are emerging in many of our communities that do not have the same requirements as skilled nursing facilities. And so we're called in to come and respond for medical, questions or concerns, et cetera. And we really need to make sure, for EMS advocacy for many years, we have been very underfunded. And the stay and treat ability that we have now, especially with telemedicine and the ability to connect the dots, care management, social workers, connecting patients to resources. I mean, EMS is doing all of this really hard work, and we have zero reimbursement for all of those efforts. So it is a huge challenge to fight that fight, and it's probably going to take a bit of time, but we have to get it done for the good of our patients and for the good of our communities.
Yeah, I would say, I've been involved for 33 years now, just started my 33rd year, and have been a paramedic for 31 of those years. And I find it incredible to talk about, as Dr. McCabe said. I can't even imagine 30 years ago talking about doing community paramedicine or some of the things that we're able to do now and some of the communities we're able to impact, and that we would actually be able to think about guiding patients to alternate destinations, not going to the emergency room when it's important, and just some of those things, and to think how far we've come. But you're absolutely right. It's not appreciated where it matters most, and we've got to be able to fund this, and we've got to be able to reimburse for it. So ultimately, we need to advocate for the importance of EMS in our communities. And often I say, unfortunately, we're not important until you need us, and then when you need us, it may be too late. And so, so often people don't think about an ambulance, and an ambulance is an ambulance is an ambulance to most people. You have no idea whether it's coming with a paramedic or an advanced EMT or I saw one state last week just passed a law that says you only have to have one certified attendant and everybody else can just be a driver to address workforce shortages. But I don't know that that's best for the community. We need to go and advocate what's best for the community. But along with advocation comes figuring out how to get you the tools that you need. Once you prove what tools you need, you have to be able to fund the tools you need.
Yeah, and
totally agree.
It's always very interesting too, because we set for the standards and we set for gold standards and looking for opportunities, but it's so community based. An EMS service that is in a very urban setting where if you throw a rock a mile in any direction, they're going to hit a level 1 trauma center and they have all the resources that they would ever need, versus rural medicine where, community hospitals are closing up almost every day. That you're lucky if you have a clinic in your area as well. And to your point, Chief Way, the EMS service might be the only service locally that is actually providing that care. So it very much is difficult, across the board to say we need one thing or another, because there's so much diversity across the United States with the EMS services. What's
the old saying? Once you've seen one EMS service, you've seen one EMS service.
Right.
And I think it's really an incredible opportunity to help tell our story during that week.
So, out of any of the days that we have for EMS week, do you see any opportunities in one or a couple that might really have an opportunity for a service to kind of plan its stake and say, okay, this is where we're going to put our efforts, and if we're going to advocate for something, this is where we might have the most opportunity?
Yeah, I think the community education one is a great one. I mean, I think the opportunity to teach people, whether it's hands-only CPR, whether it's stop the bleed, whatever it is, I think those are opportunities to be forward-facing in the community. I think I hope that every service takes an opportunity to reflect on the importance that they have in the community, and each agency does figure out a way to celebrate those providers who are providing that essential service. But I think probably the biggest impact day to me is probably the save a life, teach somebody to save a life, because I do think we've proven that your chances, I don't remember the exact number, but it's well over 50%. Your chances of surviving out of hospital cardiac arrest goes up if you get bystander CPR immediately. Well, but we found in a recent review, only 28% of people in our community are getting bystander CPR. Well, gosh, if I can teach. So last year at we did a North Idaho fair. And we taught almost 5,000 people hands-only CPR in the course of a few days. Those are the kind of things that I think make an impact in your community. I think that's where, yes, celebrating all of the things, all of the days that are themed are important. But if I had to pick one, it's the ability to go out and teach somebody else how they're going to impact a life.
Dr. McCabe, do you have a day that you think might lean in one way or another a little bit more?
So I totally agree that community education is super key, especially now that we have more tools and more resources. Even notifications on phones in communities where we have volunteers who are speaking up and coming forward and saying, oh, there's a call for a cardiac arrest and I'm 2 houses down, so I'm going to go respond while we're waiting for EMS to arrive. So totally agree. Community education is hugely important. The other piece that I really want to call out is wellness. I think, we have a lot of opportunity in the healthcare community in general to focus on how we're taking care of ourselves and how we're taking care of one another and how we are supporting one another, because it is hard to give and give and give and give if your pot is never, getting filled. And so I think it's really worthy of our time to think about our ability to provide the excellent service that we want to and the patient care that we want to. But in order to do that, what are the elements that we should be focused on in order to support that work? And I think for many years that's gone unattended to. And I think sometimes even when we think we know how to make it better, we're not really sure what's going to move the needle. So more focus and attention on that, and hearing from our frontline folks saying, what would make a difference to you? What do you need? Do you need a person to talk to? Does it need to be someone who's outside of your agency or outside of your emergency department in order for you to feel safe and comfortable to share that you're uncomfortable with what happened on a call? I mean, these are things that we need to better understand in order to really execute on moving the needle for wellness to ensure that we are doing the right things to support all of our members and all of the folks who are, providing this great care in our communities.
Well, it's always an ongoing thing, and as we learn more, we're doing more. And EMS and emergency services tends to be kind of the tip of the spear, as some people might say, and sometimes the ancillary aspect of it needs to catch up to what we're doing out in the field. Like Chief Way had mentioned, 10 years, 20 years ago, people weren't even considering, what we're doing now out in the field. Some of the skills that are being done were reserved only for the hospital and only for maybe physician or nursing level skills. So I think that aspect of it as well, continues to be a potential burden on the providers as we're being asked to do more and more and more. It's nice that we have an opportunity to recognize the providers, and I think the health and wellness, to your point, is extremely important when we talk about resilience, when we talk about recruitment and retention. If we're not taking care of each other, how are we going to recruit people to even come in the profession if we're not taking care of each other? And how are we keeping people in the profession if we're not willing to take care of each other as well? So, well, we're just about up on time. So I'd like, kind of closing statements from both of you about, where do you think EMS Week is going, or what should we be focusing on moving forward into the future to really take advantage of this kind of recognition or, realization of, hey, we're paying attention to EMS as we move forward.
Go ahead, Dr. McCabe.
Well, EMS Week has a reach of about 4.5 million folks. So it's a huge opportunity for us. And I think really what we need is more awareness around how much the work of EMS has changed and what we're actually providing. So even just educating our communities, our legislators around what does EMS actually do? What work are we doing in your community? And how should we be funded? And, how are we making sure that, to your point, Ted, we have the ability to recruit and retain and make sure that folks are well along the journey. I think EMS Week is turning into much more than a pat on the back, which is what it used to be. It used to be a slice of pizza or a smoothie or whatever. And I'm not saying that appreciation is not important, but appreciation, along with standing up for each one of those individuals that is being appreciated, and making a case for what their needs are and really driving those things home from an advocacy perspective is really critical.
Yeah, I would say, I think a couple of points. I think number one is the EMS community is a lot bigger than just the people that are in ambulances on the streets. I think the EMS community starts with dispatch, and then we have the crews who are truly out in the streets performing EMS, but then it's the nurses and the physicians at the hospital who are providing that continuum of care all the way through that patient's experience. I think we were in Washington, D.C. last week for EMS on the Hill, and I even challenged some of our representatives and senators to say that they're part of the team. And that doesn't mean I expect them all to have EMT cards. What it does mean is, though, I expect them to recognize the importance of EMS in their community and the vital role we play in that healthcare system. And again, looking at some of what's gone on with hospital closures and creating what they call healthcare deserts is EMS, often it falls on EMS to be the only provider of healthcare at all. And so in those cases, we got to take that and make sure that the entire community knows the value of what we have. But I also want to thank ACEP and just for including us and again, demonstrating the partnership that we have in providing that patient care and recognizing that no matter whether you wear a blue uniform, a red uniform, a set of green scrubs, a lab coat, or a jumpsuit and that you throw in the back of your car because you're a volunteer, whatever the case is, we're all on the same team and we got to row the boat the same way. And if we do that, we're going to get much further down the river more quickly than if we try to do it alone.
No question. And Chief Way, we are greater than the sum of our parts. Absolutely. When we collaborate and work together.
100% agree. And I'd just like to end it by saying happy EMS Week.
Yes, very much so. And we're going to have a series of additional podcasts with ACEP and the National Association of EMTs to specifically talk about, the individual days of the week and projects and topics associated with that. So I want to thank you very much, both of you, for taking time out of your day. Very important topic and very timely, as EMS Week is May 18th through the 24th for 2025. So thank you guys for coming on.
Thank you, Ted, very much.